So my sister got married in 2018, and being the supportive sister and our chief bridesmaid, we were waking up at 4 o'clock in the morning, 5 times a week. We're boxing. Our cousin was in there too. It was hectic, and I felt like I was training for the army.
Nomathemba Chandiwana is an HIV and obesity doctor at the Izinja Research Center in Johannesburg. An intense exercise routine helped her get in shape for her sister's big day 5 years ago.
And it was not sustainable. So we're able to do this for what, 3 to 6 months to fit into that dress. You fit into that dress, life goes back, your weight goes up again.
For some, weight is a deeply personal, lifelong issue, and it's not always easy to talk about.
Like most women, I've struggled with weight from the time I was a teenager.
When Nomathemba's patients started picking up 15 to 20 kilos, she went looking for ways to help them. She read studies about a class of medication that mimics a naturally occurring hormone called GLP.
So GLP is something that's naturally found in the body, in the gut. We've got this class of drugs which are GLP agonists, liraglutide, semaglutide, popularly known as Ozempic at the moment. So these are a class of drugs that were used for diabetes management. But they found that people who were using this for diabetes, that they were losing weight as well. So at higher doses, they're used for weight management. And they work simply by delaying the food in our gut, and you feel fuller for longer. So then you eat less.
When Nomathemba gave this drug to patients and saw how well it worked for them, she wondered if it would work for her too. So she consulted an endocrinologist, began taking Ozempic, and she's lost the same amount of weight as when she was dieting.
On the GLP agonists, I've also lost about 9 kilos. I've changed nothing. I'll be honest, I hardly exercise. I take a daily walk with the kids and the dogs. That's about it.
This jab hasn't only helped Nomathemba. Gillian Swan says Ozempic gave her a new lease on life when illness cut short her tennis career.
4 years ago, I had a hip replacement. And the reason for my first hip replacement was osteoarthritis. And then I had my baby, so I carried a baby with a hip replacement. And then last year, May, was where I started taking the injection because my weight was just too much. I had to bring it down. It just couldn't, my new hip couldn't carry me.
She put on more weight after a second hip replacement last year, so she consulted her doctor.
She said, you just have to start exercising and eat healthy. I'm active, eat healthy. I've tried with nutritionists, dietitians, it just didn't work for me.
With her weight at 110 kilograms, Gillian got herself onto Ozempic. She's shed 25 kilograms and feels a whole lot better.
When you are carrying the weight that I was, it's almost like you sit there and everybody's going, oh God, what is she eating now? And it really did take a toll on my confidence and who I was.
Both Gillian and Nomathemba believe doctors should rethink how they help patients with obesity. They see nothing wrong with being prescribed Ozempic if diet and exercise alone don't work.
Excess weight, overweight and obesity is a real issue in South Africa. And so I approach it like not aesthetics, but really around what excess weight does for your health outcomes. So we really want to have these drugs available for people so that they can be able to manage their weight and also just reduce their risk of other things in the future.